Good afternoon, dear patients. Today we will briefly discuss a case involving a mole on a finger. A man came to us who had, since birth, a mole between the toes, specifically on the fourth toe in the interdigital space of the foot. This mole was growing, interfered with walking, and caused slight itching, which concerned the patient. Accordingly, if a nevus or mole is congenital, then most likely it is a congenital melanocytic nevus. You can find a more detailed explanation of what a congenital melanocytic nevus is in a separate video on our channel, where everything is explained in greater detail. As a rule, these moles appear either immediately or within the first year of life. These are, as a rule, benign pigmented formations that consist of nevus cells. Nevus cells are similar to melanocytes, but they have their own distinct characteristics. Now, regarding this particular patient, first of all, the mole was quite large, more than 1 centimeter in diameter, and it was relatively soft. And then, naturally, due to its diameter, it had already formed a plaque that was raised, as you can see, above the level of the surrounding skin, and it had rather well-defined borders. A dense consistency was not characteristic for it. In certain areas around the mole, redness could be seen, which indicated constant irritation, compression, and so on of this mole, and was in fact a factor that could potentially lead to malignancy. The general approach for congenital nevocytic nevi is that, in the presence of any complaints, itching, and so on, especially if they are located in such a trauma-prone area, these congenital nevocytic nevi must be removed. This mole was of a light brown color. It was wrinkled, lobulated on the surface. You could say if it were larger, it would resemble the convolutions of the brain. That's it. Well, and during dermatoscopy, a dermatoscopy was performed, no obvious signs of malignancy were found, and during the dermatoscopy, against the background of the light brown color, individual darker spots were noted. They coincided exactly with the location of small hair follicles, which is quite characteristic of congenital nevocytic nevi. From the surface of this mole, considering its rather large size, first a scraping was taken for oncocytology, and second the S100 protein was tested, which is a blood test. The results of these tests were normal. Accordingly, the congenital nevocytic nevus was then removed, followed by a histological examination. An injection of lidocaine solution was used for anesthesia. This was local anesthesia, and accordingly the removal was performed using a radio wave technique, after which the removed mole was placed in formalin and sent for histological examination. During the histological examination, no signs of malignancy were found, only signs of inflammation were detected. According to Western authors, the approximate probability of transformation into melanoma is 3 to 5%. However, considering that this mole, or congenital nevocellular nevus, was bothering the patient and was slightly inflamed due to constant trauma, it required removal, which was carried out for this patient. After removal, a small superficial scar formed at the site of the mole. Accordingly, there was no recurrence of this mole. If you have any moles that bother you, cause itching or pain, or are located in areas with a high risk of injury, meaning they are frequently traumatized, it is generally better to have such moles removed rather than waiting for a possible transformation into a malignant tumor.